this video we are going to cover the types of the transplants. So we start with questions. The question 1, what is the heterotopic transplant? Second question is, what is referred to as the auto transplant? The third question is, what is the xeno transplant? So we'll find out these answers in this video, and there's also a bonus question which is in the end of the video. So to start with, we look at the orthotopic. So the orthotopic transplant. So here the organ, if you see, the organ is implanted in the same anatomical location. It is implanted the same anatomical location in the recipient as in the donor. So here basically the deceased organ is removed. The deceased organ is removed. So this can commonly include the lung, the heart, the liver, as well as the intestine. Next, we move on to the heterotopic. So in case of the heterotopic, here the organ it is implanted in a different anatomical location, and here the deceased organ is left in place. So here the examples, it includes the kidney as well as the pancreas. Next, we move on to the auxiliary transplantation. So what is the auxiliary transplantation? The auxiliary transplantation, it deals with, there is a partial tissue from the donor. So the partial tissue is from the donor, and it is used and this acts as a temporary support. It acts as a temporary support for the recipient. It forms a temporary support for the recipient's injured organ. So the partial tissue from the donor is used, and which acts as a temporary support for the recipient's injured organ, and this remains in place, and it remains in place. So what is the example? The example is the left lobe of liver. Then we look at the auto transplant. So what is the auto transplant? The auto transplant means that there's a transfer of cells. So there's transfer of cells, there's transfer of tissues, as well as there's transfer of the organs. So they are done within the same person. It is done within the same person. Next comes the concept of the allotransplant. So what happens in the allotransplant? So allotransplant, there's a transfer of the cells tissue or the organs, and this is within the same species, and it deals with the same species. So it is within the same species. Then we move on to the xenotransplant. So in case of the xenotransplant, there's a transfer of the cells, tissue, and the organs, and this occurs in case of the different species. Different species. Lastly, we will look at the isograft. So under the isograft, we need to know there's transfer of the organ or the tissue. This transfer of the organ or the tissue, and this occurs within the it occurs within the genetically genetically identical individuals. Example, there is the identical twins. So now we will jump back to answering all our questions. So here we have the answers. So the first question we asked was, what is the heterotopic? What is the heterotopic transplant? So the heterotopic transplant is nothing but the organ is implanted. It is implanted. The organ is implanted in different in different anatomical location. It is implanted in a different anatomical location, and the deceased organ, what is meant by the xeno? What is meant by the xenotransplant? So the xenotransplant, it refers to the transfer of the organ and the tissue, and this is within the genetically identical individuals. So the example here, as we know, is the identical twins. So now we are going to look at the bonus questions which can be answered in the is left in place. So the example here is the kidney and the pancreas. Now the second question we asked was, what is the autotransplant? So autotransplant means that there's a transfer of the cells. There's transfer of the cells, tissues, or the organs, and this is within the same person, Now we will look at the third question, that was comments. So the first question is, what is meant by the orthotopic? What is meant by the orthotopic type of transplant? The second question is, what is meant by the auxiliary transplantation? The third question is, what is meant by the allo transplant? So these questions can be answered in the comments.